afternoon, everyone. Thank you so much for joining our men's health webinar, Changing the Narrative on Men's Health, How Employers Can Make the Difference. My name's Nicole Core. I'm the Marketing Director here at Medigold Health. I'm just going to run through a couple of quick housekeeping bits before we kick off properly. The webinar is being recorded, and you will receive a link to the recording of the webinar in the next day or so. That will be via email, so please look out for that and feel free to share that link with colleagues, friends, family, whoever to watch the webinar on catch up. You'll see at the bottom of your screens there's a Q&A function. If you've got any questions throughout the webinar, anything that comes up, just pop it in there. Our panelists, we do have a Q&A slot at the end of the webinar, and our panelists will do the best that they can to answer as many of those that they can. We often get quite a lot of questions, and sometimes we do run out of time. What we will do with that is we'll capture all of those questions, and I'll work with the panelists to do a Q&A document that will then circulate via email. So please just pop any questions that you have in, and we'll come to those at the end. So we've got a lot of people registered and we've got a lot of people tuned in. So thank you and welcome. And without any sort of further ado, I will hand over to our panelists to introduce themselves. Over to you, Nicky.
Hi, I'm Nicky Piper. I'm the Chief Nursing Officer here at Medigold Health. Nice to meet you all.
John?
Hi there. Yeah, my name's Dr. John Colvin. I'm one of the occupational physicians working for Medigold. I've got a background in both the military and in sort of construction, so I'll be sort of approaching a lot of what I'm talking about from that perspective today.
Thank you, John. Steve?
Hi, I'm Steve Thompson, Health Awareness Campaigner for Medigold. I've been diagnosed with early onset dementia and probable CTE from brain injuries in the past.
Okay, thank you. I'll very briefly cover what we're going to be looking at over the next hour. So the panelists are going to chat to you about the main factors contributing to men's poor health outcomes. John's going to talk about some health issues facing men, including warning signs, symptoms and risks. Then we're going to have a chat with Steve about his diagnosis and what that means for him health-wise and mental health-wise. Nicky's then going to chat to us about why we need to focus more on men's mental health and what action employers can take to support the improvement of men's health. And then our panelists are going to give you a little takeaway each of their sort of top tips for men's health. And then it's over to you for the Q&A. So without any further ado, I'm going to hand over to John, who's going to kick us off. And John, I'll try my best to keep up, but just say next slide, please, as and when you need to.
Yeah, that's absolutely fine. Yeah, go for it. So yeah, hello everyone. Yeah, welcome. So I'm going to be talking to you for the next sort of 15 minutes or so, just about really what I'm going to be trying to do is actually set a bit of a scene about what is actually driving some of these statistics that we can see on the screen. I'm not going to go into each of them in detail. The sort of reasons for some of them will probably become apparent as I'm talking. The one I would like to focus on just quite quickly is just obviously the one on the top left here, which is that actually on a global basis, regardless of any sort of socioeconomic factors, men on average have a 6-year shorter life expectancy than women. Now, what's interesting about that is actually that in developed countries, such as our own, that effect is actually greater. So we know it's not a money factor that's driving it. And it certainly seems like it's something more than just the biology of having a pair of testicles and testosterone coursing around your body that actually make the difference here. So we'll come on to that in a moment. So what I'm going to do is talk about what seems to be driving these things, and then I'm going to talk a bit about the most common kind of health conditions, not focusing so much on the signs and symptoms, although we'll cover them, but more about the ways in which men's health behaviours actually impact and increase their risk from those conditions, which will hopefully give people a bit of a framework from which to approach their thinking on men's health moving forward. So we could just move on to the next slide, please. Great. So let's try to think about this in a logical kind of progression, starting with individual sort of men's factors, and then understanding how then that translates onto sort of wider cultural and societal changes. So we know, factually, young men were very good, and certainly men even to varying degrees as they get older, are very good at engaging in risk-taking behaviours. A young male brain is sort of programmed to feel a bit invincible. We take disproportionate risks, but also we're very good at not particularly thinking about the longer term consequences of health decisions and health behaviors that we're actually engaging in at the time. Peer pressure has been, it is something that, although I'm sure we both think on an informal level, has actually been shown in the literature to be important in promoting this. I saw an interesting study when I was doing some reading for this, which stated that young men, when trying to impress a partner, will typically drive faster, but once they have a partner, they'll typically drive a lot slower. So there's obviously a bit of bravado that plays into all of this. Now, otherwise, the other thing that's important to note, and it'll become, be illustrated later. Actually, interesting on the global basis, for whatever reasons, we like to smoke, we like to drink, and we like to eat more than our female counterparts. So actually, those behaviours in and of themselves on a global basis actually do end up having quite a significant impact on our health. So moving up from the individual level, and I think these cultural factors are probably the most important to consider. Certainly in Western cultures, there's a societal expectation that men are stoic, they are in control, they are physically capable, and certainly historically, any sort of acceptance or acknowledgement of ill health has been seen as a failure to fulfill that role. Interestingly, that then obviously means that, as I'm going to discuss shortly, that men are actually a lot less likely to access healthcare. They're more likely to deny any symptoms, and they're more likely to effectively do a bit of an ostrich and stick the head in the sand about any symptoms. Now, interestingly, in other cultures, so certainly in subcontinent Asian cultures, where the idea of the sort of societal expectation of a man is that he cares for his family, where health promotion has aimed to or been marketed that accessing your GP and looking after your health improves your ability to fulfill that role, men suddenly were shown to be much better at actually attending the GP. So there's not an innate unwillingness to engage with your health. It's actually probably a case of actually how that's marketed in terms of what people are looking to do. Now, we all know about the masculine stereotypes, this sort of just get on with it, man up, harden up. And this guy sort of matches this idea of stoicism, doesn't it? Fortunately, the narrative around this is changing. There are certainly scenarios, and there's certainly there's a lot to be said about having resilience, but that resilience needs to be appropriate, and certainly a consistent blind resilience or stoicism to all factors is not actually likely to be helpful in the longer term. Finally, these two kind of ideas actually linked to this. There's just historically and probably to this day continues to be a general lack of discussion surrounding men's health, and that's why we've obviously got people like Steve here today who are doing such an important job actually just starting a conversation, whether it's about mental health, whether it's about other specific health conditions, but in general creating a better habit for men to actually discuss. Oh, next slide, please. I just tapped my keyboard thinking that would change the slide. So there we go. So there's some other things to think about as well, actually. Occupational factors do play in. Men are more likely to be exposed to physical and chemical hazards. We spend a third of our life working in terms of total hours. So actually, it seems like this is likely to have an effect on men's health over the longer term. And although workplaces are certainly the more traditional male-dominated workplaces are slowly changing, it's certainly industries like construction and the military are still a long way behind the sort of 50-50 split that we'd necessarily expect. The second thing to mention is that these jobs actually typically have a number of factors which make it harder to engage in sort of healthy behaviors. If you're working 12-hour shifts away from home, it becomes very difficult for you to be able to get to the gym. If you're working offshore, you're working in an environment where you don't actually have much choice or access to healthy eating options. Again, this can be quite challenging. Maintaining a diet can be quite challenging. Finally, thinking about more isolated roles, men are more likely to do jobs like lorry drivers. Mental health issues are then likely to be unaddressed. There's not likely to be the same level of social support for those that are starting to struggle. Finally, there's again, men are more likely to work in jobs where sort of typically on a self-employed basis or more manual or physical jobs where if you're not physically at work, you're less likely to be paid. You're expected to be self-sufficient. And this results in, again, it's a small factor that contributes to people effectively trying to deny or put off any symptoms that might result in a sort of work issue. So what is the sort of net result of some of these things? Well, really, the end result in the net behaviors is men have a tendency to be less interested in their health. As a result of that, they end up being less educated in their health, and therefore sometimes there's just a lack of awareness about what things to even look out for. And then finally, they're hard to access. Men compared to women, men much less frequently go to the GP or access health support of any kind. And therefore, combined with the other factors, the societal expectation, occupational factors, and their individual belief that they might be infallible, it makes these men, or men in general, a bit more tricky to access. So now we'll go on to the next slide now, please, Nicole. We're going to talk a bit about kind of the big health issues facing men. Now, contrary to what some people may believe, there's often a view that men's health involves testicular cancer, it involves prostate cancer, and it kind of stops there. Realistically, the biggest killers of men are things that are the big health issues for everyone, and certainly in terms of physical health complaints, cardiovascular disease is the number one. Now, as we can see, the number one risk factor for cardiovascular disease are actually lifestyle factors, specifically smoking and poor diet, and specifically sort of overweight and obesity. So there we go. Straight away, we can see that men are more likely to be at risk of this. The other two things on there, high cholesterol and high blood pressure, are important because actually they're things that happen silently. You're not, unless your blood pressure is extremely high or your cholesterol is extremely high and you develop other issues, it's unlikely you're going to have any symptoms of these. And so men who are not attending the GP, not aware of the health generally, and not accessing any sort of regular random checkups are unlikely to be detected. These conditions are unlikely to be detected, and therefore over time their risk is likely to grow until they develop issues. So in terms of, just in case people aren't aware, obviously when we talk about cardiovascular disease, what we're actually talking about is furring up of the vessels which supply your heart or your brain, which then mean that eventually there's a blockage of blood causing damage. So that can result in things like angina, heart attacks, and stroke, which are obviously quite significantly disabling. So how do we then prevent these? There's been a rise over the last time, and certainly I'm starting to now see in construction sites this idea of well-man checks, which I think are really important. Men can turn up, again, good, clever bit of wording, they are well, but they're just being screened to check if there's anything they're not aware of, and typically blood pressure is a good way to catch that. Anyone that is identified as being at high risk can then go and receive treatment from the GP. Certainly I'd encourage almost everyone over the age of about 40 to if they feel necessary, to at least have the blood pressure checked once annually, but preferably have a sort of home blood pressure monitor, which means they can sort of semi-regularly check the blood pressure and make sure it's not creeping up over time. Obviously, any symptoms suggestive of chest pain or shortness of breath should be seen by the GP. And in terms of the actual ways to prevent this in the longer term, likely to be the most effective are lifestyle interventions. Now, at risk of the sort of typical doctor broken record, eating less, exercising more, and stopping smoking are likely to be the most effective. It's worth mentioning here, and I'm going to mention it again at the end, that actually even a small reduction in each of these features is likely to have a big impact over the longer term. Just cutting down from 20 cigarettes a day down to 18 is still likely to make a difference. There's often a push for men to try and go cold turkey, right? I'm stopping smoking, I'm going to the gym 18 times a week, and I'm going to start eating, half a grain of rice a day. It's clearly not sustainable. And so people should be encouraged actually just to make small changes over time, which are then likely to have a significant impact on their health in the longer term. So if we move on to the next slide, please, Nicole. Okay, so type 2 diabetes is another one. And this diabetes is effectively what happens is your body becomes resistant to a hormone called insulin, which you use, and that hormone effectively packs sugar into your cells once you've eaten. Without that hormone working efficiently, you end up with high blood sugars, which end up causing small vessel damage and nerve damage over a long period of time. Now, diabetes in and of itself people will live with diabetes and not necessarily experience too many symptoms, but with poor control over a long period of time, there are a number of very significant and potentially very disabling complications that can arise, specifically with relation to your vision, neurological damage to your hands and feet, damage to your kidneys, and then increasing your risk of things like heart attacks and strokes. Now, the challenge often with these, we've talked about how lifestyle factors might influence the last one. The challenge with diabetes is it requires ongoing monitoring and engagement, which men are typically less good at for longer term conditions. And so anyone with these conditions should be advised that they need to be continuing to, people will need encouragement to engage with the management of these. And this is better control is likely to result in better management in the longer term. So it's more likely to affect men over the age of 40. A family history of diabetes is important to consider. And if you're overweight, you have a 3 times increased risk of developing the condition. And if you're obese, you're 7 times more likely to develop the condition. So again, we can see how regular exercise and a healthy diet is likely to have a big impact on their outcome. Next slide, please. So now I'm going to talk briefly about, the 2 most commonly thought about men's health issues, really. And again, these are important because actually in general, they both have a very good outcome when they are detected early. There's a very sort of well-used phrase, which is that actually men with prostate cancer are more likely to actually die of something else, such as cardiovascular disease. However, if symptoms are ignored and it's not picked up until a very late stage, then the outcomes are much poorer. And so actually, this is where examples of kind of awareness campaigns, certainly through sport, have been really helpful in actually increasing men's awareness of these symptoms and improving outcomes. So with prostate cancer, we're thinking about things like difficulty passing urine, feeling like you've not emptied your bladder fully, and difficulty getting or maintaining an erection. Now, an interesting sort of survey which I found relating to this, and again, it relates back to men's reporting of symptoms, is that there was a survey of older men conducted, and they found that in that survey, 80% of men reported that they would find experiencing erectile dysfunction a cause for concern and something that they felt would need to be looked at. So there'd be something that would be worried about. Interestingly, when they looked at actually how many of those men had experienced erectile dysfunction, only 30% of those that reported issues with it had actually sought help for it. So you can see there's a disconnect there between what people are actually experiencing and are worried about and what they're then actually willing to access care for. So I thought that was quite a good, a good example of some of the sort of themes I'm trying to demonstrate here. So thinking a bit about testicular cancer, just to cover that, this is a condition which typically affects younger men. So the challenge with this is actually getting men to actually believe that they might be at risk of it. And then if they do start or notice symptoms, actually to then go and act on them. So again, we've got campaigns like regularly checking yourself, knowing what's normal for you. And again, feeling confident to go and seek help if you do notice a lump in one of those regular checks, because a delay in reporting of this is likely to be associated with a worse outcome. Next slide. Okay, so I'm not going to talk too much about mental health, partly because you'll all be going to sleep, and partly because I think Steve's going to do a much better job of actually illustrating some of these main issues. I think it's fair to say there's been a huge increase in awareness, both in the general population and amongst men, regarding mental health issues. They are very common. We know 1 in 8 men at any one time are suffering from a common mental health condition. One thing I would say, though, is that areas in which we tend to see more men, so sort of the typically more harder to access areas for men's healthcare, still represent areas where this is a challenge. Certainly, my experience in construction, campaigns like Mates in Mind are certainly helpful in improving these sort of scenarios. But as someone who sits down with construction workers almost every week and undergoes screening questionnaires, it's very, very, very rare that I hear I have anyone actually admit to any sort of mental health issues, whether that's low grade or more serious. And that's that's not in keeping with the statistics that we know are out there, that 1 in 8. So there is a disconnect there between some of these populations still, although I think things are improving. So really, what is the issue then? Is it, do men have less mental health issues, or are they harder to access, or is it actually just that there's still an issue with getting people talking about it? Difficult question, but I think, you know, I'll let Steve talk a bit more about that. If we move on to the next slide. So finally, this is my final point. Something that I think is really overlooked, and I've seen it in my personal sort of practice quite frequently, or I've noticed it over the last few years. It's really not to be underestimated about the actual psychological impact that a physical injury can have on someone. I've seen soldiers who come in with a mildly sprained ankle, and it's caused such a level of concern and anxiety that it's been completely disproportionate with the actual extent of the injury. And when you've dug down into it, what's actually happened is people who've previously seen themselves as being you know, physically strong, physically capable, again, that kind of invincibility brain, it's resulted in a real shake to their confidence and self-esteem. And this can happen to men at almost any age, depending on their experience. And certainly, although not all are affected equally by this, I've certainly seen some people where the injury itself has actually ended up becoming very much secondary to trying to help them manage the psychological impact. And I think this is something that is probably really quite important for employers to consider, that some of these occasions it's been, well, you know, a young chap who came in and he'd broken his arm, so he was expected to get better in about 6 weeks. His employer had said, yeah, off you go, see you in 6 weeks, come back. In the interim, he'd spent the whole time worrying about whether he was losing his job, whether he'd ever be able to go back to work again. Now, clearly that was not something that was true, but he'd lacked the information, and he'd lacked the reassurance that that was the case. And so for him, the worst part of his injury was actually the psychological component, rather than being in a cast for 6 weeks. So it's at this point, really, I suppose maybe my final point is, we've talked about some of the reasons that lead to men's health behaviours. Obviously, a cultural component that's really important. And as men, we're often sort of, you know, we're role model based, really. We follow what others have done before us. We follow what people are doing as around us. And so I think it's really important that, you know, I hand over to Steve now as a role model for a lot of men, you know, elite athlete. He's worked in both, you know, boardrooms, he's worked in construction. He's got a really good understanding of what men's health actually looks like on the ground, from both his personal experience and what he's seen, as well as just, you know, life as a man. So I'm going to sort of hand over to him now to give a bit more of a personal insight, and hopefully add a bit more sort of meat to the bones of some of the concepts I've been talking about.
Thanks very much for that, John. Yes, sorry. So I'll get through my where I've come from quite quickly, and then actually go to the mental health side of what's happened to me. I was a professional rugby player since I was 18. Retired through injury in 2011, but in between that, to keep my brain ticking over, I owned clothes shops, done work with breweries, but then also once I finished, I moved to Dubai, got into the construction industry, run joinery factories and fit out companies. So in the construction world, which was totally different, I must admit, over in Dubai, where I was suited and booted. Emirates Airlines owned us, so you know, I was in the big boardroom, talking to some people with a lot of stress going on there. But it wasn't until about 2015 where everything just started getting to me, and my memory started going. I was coming out of meetings not realizing what was actually going on. Suddenly I started going in within myself, and all of a sudden my memory just started forgetting meetings, and everyday tasks were just hard to do. Totally fell apart. Had to step away from my work. Didn't really know what was going on. You know, people were saying, is it stress? What is it? Moved to Cyprus for 2 years, where I had 2 really hard years of literally sitting in the garden. When I'd taken the kids to school, I'd be in tears for hours. My wife obviously didn't know what was going on. I didn't know what was going on. Then we managed to pull ourselves together, get back to the UK, where I started working in the construction industry again, but fixing aqueducts, because I needed to put bread on the table, roof over the kids' heads. So I had to work when, obviously, you know, it's in sort of a tough environment, but I was happy to do that. Body was feeling good, but then I had an old rugby colleague that contacted me and spoke to me about his symptoms, which were memory loss, anger, emotional changes, whole personality changes, and obviously big chunks of his life that he couldn't remember. And when I came home to my wife Steph, you know, when I explained that to her, she was just like, Steve, you're explaining yourself to me. I don't, you know, what's going on. So I went and had the tests. It took 6 months because of COVID to have the tests and get the results back. And the results was early onset dementia with probable CTE, which I must admit at first, I was on a massive high because I had the diagnosis. I knew there was some reasons for it, but then suddenly the lows started coming where, you know, I just thought, you know, I've let my family down, you know, I'm letting everyone down. How can I work? Because all of a sudden then, because I came out in the public, in the press, because I wanted to make this, you know, so people understood what was going on, I thought it was my right to do that, because of being the professional rugby player. You know, we got this through rugby, and you know, at first there was 3, then there was 7, now there's 300 that have been diagnosed with this, with hundreds waiting. I thought it was only right that I do this. The problem with that was all of a sudden people wanted to speak to me, but then didn't want to employ me. The way it works as well, if I'm on site and someone else gets injured, they might not get paid out because of insurance reasons, because I'm on site, and they could say, well, you were supposed to be looking after him. I say I was, and they say, well, can you remember that you were? So when you look at it like that, you know, a lot of opportunities have been taken away from me. And I think that with a brain injury, plus having things taken away, like the possibility of working, I've always worked. I've always, you know, if I have to brush streets, I have to do whatever. It's sort of my, you know, if people say it's too masculine, it's too masculine, but I want to provide for my children. I want to be there, and I want to do the best I can. And then suddenly when people are taking this away from you, and I've taken it away from myself because what's happened, I find it very hard. You know, have I been close to suicide? Yes, I have, very close twice. And I think it's only right that I talk about it. You know, I'll see another doctor, Dr. Gavin, who's a psychologist, and he's helped me in these times of, I spray my wife's perfume on my arm. So when I go out and I start getting anxious, it's the smell that brings me back, pictures of my kids on my phone, you know. And it's fun because I talk to so many people. You know, I was at work at Twickenham at the weekend, and suddenly I start, you know, opening up and talking to people I don't really know, which I found weird. The hardest ones, they're the easiest ones to speak to and actually tell the truth and really say what I'm coming to. And I've had so many people sort of saying that to me as well, that, you know, you surround yourself with people. Steph, my wife's very supportive, but sometimes it's still hard to speak to her about it. Whereas sometimes when you speak to strangers, I've just been able to unload, and it sounds bad. So, you know, and it's been a great experience for me to learn that. So I speak to people and say, look, it's a lot of the time, it's not the people you expect that you think are going to be really there for you and you can really explain this to. They're the hardest ones. It's people you don't really know, and they will surprise you with just how good they'll be. And I found that in my life, you know, in the last 2 years, how to do that. And, you know, like I say, I talk about the suicides side to it because I believe this, you know, we've looked at those stats earlier and it's just horrific, and it makes me feel so sad. You know, there's a group in the community of us in the rugby sector that are talking together, and we had a suicide 2 weeks ago, a 31-year-old, 2 young kids, and it's just horrendous. So that's why, you know, I've took the choice to come out and speak, and I wish I'd had understood what was going on me earlier so we could have saved more people. But, you know, we're here now, and, you know, there are so many different ways. You know, and I hate saying this, but it's exactly how I felt when I was younger and someone committed suicide. In my mind, I used to think they were weak, and it's totally the opposite of what it actually is in that moment. And I've been there, like I said, and I was the most selfless person when I thought I was going to take my life by a train. And so that you come up, you just feel like you're just a drain on everyone else, and everyone else would be better without you. And, you know, when I spoke to Dr. Gavin again, he said to me, you know, there's ways now work, because I was just so tired with sort of wrestling with my mind, trying to get myself through. Can I work? Can I not work? Am I good enough to be around my kids? Am I good enough to be with my wife? You know, I've stopped going to see as many friends still now because my memory's not what it was. I feel like I can't really hold a good conversation, and you know, people are better off without me, so I'm still learning that. I've gone on to medication now, and there's so many different medications out there, and you know, I'm getting a bit more better, because I was actually more scared of the highs than I were the lows, because when I was having highs, I was organizing lots of things to do. I was amazing, and then all of a sudden, as I start coming down to normal and below normal, I was having to cancel it all when I was on a downer, and suddenly let people down again, it seemed. And it was just a vicious circle. So, you know, I was one of these, when it comes to medication, no, I'm not doing that, because one of my friends' mums, when we were younger, went on medication. And the way we explained, we thought she turned into a bit like a zombie. And I thought, I can't be like that with my kids. But on the other hand, I can't be so up and down, you know, to the point there's some days where I didn't want to come out of my bedroom, and I was just there, and suddenly I'll go on the medication and it's sort of leveled me out, and it gives sort of the more higher percentage of a better me for my kids. You know, the way I look at it, I've had my life, and now I'm here to be for my kids and my wife. And that's what I really try and zone onto, is all these little 1%ers, I call them, you know, training, fitness, you know, like Dr. John said earlier, you know, it's one of these where, you know, you go to a doctor and they tell you, oh, you've got to have a better diet. You know, it's the whole thing it's just lifestyle, but it's balance. You know, they're not saying you don't have a drink. You know, I'm on medication. I have a glass of wine with dinner because it makes me happy. So, you know, my wife and I, we have a glass of wine. It's nice. It's something of a balance of life. And also it's, you know, I've got to keep living. You know, sometimes rather than being the victim, which, you know, I played on myself and my mind for so long, that I just thought, you know, I've got to get out of this now. And the communities that are out there and the people you can talk to is amazing. And, you know, when I was a young rugby player, testicular cancer was a big thing, a quiet sort of thing that was getting, I know there was 2 lads under 20 that I know had it. And the reason they knew they had it, we were in the showers, it was the lads talking, they were like, oh, what's wrong with this? And it wasn't actually the lads that had it that went to the doctors, it was friends and lads that went, you got to go and check him out, this isn't right. And that's 2 lads that still will have children now, all because of that. And this, when it comes to mental health, is a big thing. It's not the actual person at times that will actually say about it. It'll be the people around them. And I've had people say to me, you know, oh, I thought you'd be the last person to want to commit suicide or have mental health problems, or, you know, just fall apart. You know, you've always been so strong and things. And it's, you know, when you look at it like that, you've just got to be open with yourself. And, you know, by actually me opening up to myself now, you know, yep, there's some people that don't speak to me anymore, and they don't know how to speak to me, and I think they find it a bit strange. Whereas, you know, I've got a good circle around me now where, you know, we're all in, and I like I said, I live my life for my children.
Fantastic. Thank you, Steve. Thank you for such an honest share. And I think we've already had a couple of comments. Yeah, we've had quite a few comments come through and a couple of questions that we're coming to at the end. Just thanking you for such a heartfelt share, as you always do. And I think it's just so important that you're there raising that awareness and carrying that message. So thank you for that. We'll come back to you shortly. We'll now move over to Nicky.
Thank you. Quite a difficult one to follow that. Thanks, Steve. My focus is really to look at what employers can probably think about doing or consider doing to try and kind of break down some of the kind of behaviours, some of the kind of thought processes that kind of have been covered by my two esteemed colleagues here. So I'm kind of just going to look at that kind of role that employers can play, but also that individuals can play as well as part of that kind of breaking those barriers down. And we looked at a bit of statistics as a starter, and the ONS have recently reported 500,000 more people are out of the labour force because of long-term sickness. So it kind of just adds to the environment we've just come through with kind of COVID and difference and changes of behaviours. But this is also a labour force that we can tap into to fill those kind of vacancies that are out there, and looking for kind of people to kind of come back into that environment. And it's about looking at how employers can change this. And there's a lot of evidence around how you market your initiatives out there to kind of attract people to come along to those kind of health and well-being campaigns that are kind of placed there in the environment. In my kind of career, I come from a nursing background, which I failed to say at the very beginning when my colleagues stated where their backgrounds come from. And I've worked alongside construction and many other kind of environments, including places like the Metropolitan Police, where, you know, we've got very male based environments, even though the statistic on that is changing. And we looked at different examples of breaking down that kind of normal barrier of just pop along and have your blood pressure checked. And we tried to kind of make it a bit more engaging. So a couple of sessions we did, and one thing that often attracts people during wellbeing sessions is to add that element of competition into those checks. And in a construction environment, we did kind of a mini gym kind of setup for their well-being, and we looked at all elements that we've talked about, but made it almost like a workstation within a gym environment. So we did some kind of body fat examples of how it feels if you lost half a stone to do up and down sit-ups versus what it's like while you're carrying that weight. So we kind of introduced that competitive element into the well-being initiatives. We also put together a rowing machine and did who could row the fastest over a given period of time, and we kind of put prizes on the back of that. So that kind of started to open up that kind of competitive element, but also got people talking. And within that kind of setup, we had things like the testicle examinations, how to look at, what to look for. So we combined a little element of all things, but also then how to make improvements. Also, it's about grabbing the attention. Where do we have a few moments of time that we're not utilising? And the use of articles in toilets, on the back of doors, when we all have those few moments in our day that we can just take time to read about how we can look at addressing various small changes to our life. So toilet cubicles are a really good place to put some of that messaging to start kind of opening that conversation. Again, it's about normalizing speaking. And I think if you've got people that can lead from the top and not be afraid to say that being stressed is okay, being unwell is okay, and what we can do as an organisation to address those concerns and start to break down some of those barriers, I think they're really proactive ways in which we can start addressing some of those, as John very rightly said, those kind of unrealistic thoughts and behaviours, and breaking those barriers down. Talking is something that men struggle with, and it's about how do you set up environments which make that ability to talk a lot more kind of easier and open. And it's about giving that safe space, and the kind of latest thoughts are setting up something called a man's shed, where people can go, and often the sessions are facilitated, or they have someone in there that can facilitate signposting, direction, for those that may well be in that moment just struggling or suffering. So some avenues. So that's like a safe space, if you like, that kind of is very in vogue at the moment. Thanks, Nicole. I think it's quite, the reasons are there why we need to do this, and I think there are some simple quick wins that can happen here to start to change and break that barrier down. One of the things when we were setting up this webinar that John and I was kind of in conversation around are some of the common themes that we're seeing in the case management referrals that are coming into Medigold. And one of the kind of common themes that we're seeing at the moment, which kind of triggered us to have this conversation, was we're getting referrals for predominantly men in the 45 to 50 age group who are very high up in their business, in their organization. They're kind of at the point of burnout, because they've kind of carried that ownership of responsibility of being the male, the breadwinner, the controller in the house, the one that everyone relies upon, the team lead. They carry that kind of responsibility. And when things start to kind of come a bit out of kilter in their life, they then become quite kind of disenchanted and struggle with what's going on for them. And often they're referred into as with a, you know, work-related stress or a chronic-based stress type situation. And we were talking about ways and means in which this can kind of be prevented, and how, or early intervention, because once they get to this kind of burnout breaking point, what they really need is quite a bit of time off to actually give themselves a little bit of breathing space, recover, regroup, think about their life and their works. And we were saying how if only there was an opportunity along the way that they were able to have been open, transparent, talk to somebody, or have an avenue in to kind of break those kind of myths and behaviors that they've been following for a long time. And obviously, if they do go out of the business, that's a huge gap in the workforce, and a huge gap in the teams, and you know that then changes some huge dynamics within the workplace too. So some of the kind of suggestions that we felt would be really useful, and I don't think we're ever really taught these things as managers, is to have those kind of conversations, have that transparent, open conversation about how are you, and actually be able to then listen to what the kind of key points are, and be able to work on those key points with individuals. And you don't have to be a specialist or a psychologist to do some of those basic things. It's about being able to do some training with managers to help them learn to listen. For some people it comes naturally, but for a lot of people it really doesn't. And you need to learn those skills and be able to give people that time and opportunity to learn those skills. So management training was a big pointer within this kind of whole theory. And also the use of the stress risk assessment. Now, there's lots of stress risk assessment tools out there, and I think a lot of times people are afraid to use them because they probably don't really understand how or what benefit it would be. But they're a really effective tool to start those conversations, and they come along in a real kind of plain setting. I mean, the HSE has them, a lot of organisations have them, but they're very rarely used and put into the scenario that people are struggling. So one of the kind of real good focus points on this particular cohort of people is to look at early intervention breaking down some of those barriers along the way. So ensuring you do really active one-to-one sessions with your senior managers to allow them that space and opportunity to talk about the challenges that they're facing. And often things that bring people to this stress point are very rarely just one contributory factor. It's usually a multitude of things, from increased workloads, personal changes within their life. And as we hit that middle part of life, you know, we have lots of bereavements, we have lots of other challenges. At the moment, there's lots of financial challenges out there too. So all of these things are going to contribute to where a person is at any one given time. So the more we can look at those preventative, proactive initiatives, the less likely we are to get to that kind of burnout point, which is best avoided if we can. I appreciate it's easier said than done sometimes, but it actually will help and prevent people going to that point of suicide or going to that point of despair, going off sick for long durations of time. So that early intervention, giving people the skills to be able to manage those situations, because listening and talking is really difficult unless you actually feel confident enough to do so. But the impact of it has a massive positive outcome. Thanks, Nicole. So I guess I've covered some within the context of what I've just said. So, you know, when you're looking at wellbeing initiatives, consider the marketing around them, make them attractive, engage the workforce in looking at those kind of initiatives, run checks, as John said, something very simplistic like a blood pressure checker or a height weight checker, or bring in, you know, different organizations that will help. But all these small changes, and you know, as Steve said, getting out and about, exercise. It doesn't have to be a trip to the gym every day for 12 hours. It can be a walk down the road, you know, increasing your distance, time on time, knocking 2 cigarettes out of your 20 with a plan to get rid of more in the future. But it's about trying to look at that greater change, but be it subtle and over a period of time. So think about your workplace health stuff and make it attractive. Again, the use of the mental health first aiders is a really useful tool as well to pick up and signpost. There are already people within the work environment. They have the skills to listen and the skills to be able to signpost out. So utilize those. And as I said, think about setting up perhaps a man shed within a work environment, which has got that information available, which will be kind of facilitated a little bit by the mental health first aiders. So people do know where to go to, they've got an outlet, and there's some information that could be useful to them. Lead from the top, as I said, I think is really key. If it happens at the top, that will cascade down, and vice versa from the bottom up. So really good to be open, transparent, ensure that there's enough information out there and adequate tools for your employers to work with. Thanks, Nicole. I think we're...
Thank you, Nikki.
My bit done.
Thank you so much. I'm conscious of time and we have had quite a few questions. So I'll just go, if you just could whiz round just to give your kind of standout top tips. I think some of them will be bits that you've discussed, but if we can just start with you, John, if you can just give the audience something to take away today. We've lost your sound, I think. Or was that just me? Hold on. We're going to be...
Sorry, that should be working now.
You're back in, you're back.
Yeah. So, I mean, for me, I think that the most important is this idea of, you know, a team sport or a group activity. And in simple terms, that for me, that attacks a number of different areas. It's likely to increase your physical fitness. It's likely to increase your social network. It's likely to be beneficial for your mental health, but also, as Steve said, it then gives you a forum. You see, there'll be the other guys talking about what's going on. There'll be the other people that are there that are talking on. It gives you a really holistic output for your mental health in a way for your mental health and your health in general, but packaged in a way that is actually fun and likely to be sustainable for a longer term. So that'll be my number one tip on an individual basis. The second thing is, as it's come up a lot of the time, is talk to each other. I think, as Nicky says, having conversations both on an informal basis with friends, but as an employer, it's a skill. It needs to be practiced. And it might not necessarily come naturally. So if it doesn't feel particularly easy the first time, that shouldn't be used as a disincentive to try in future. And then finally, as I said during my slides, we're not aiming for perfection, we're aiming for better. And that can take any sort of form. And even a small step towards improving your health in any sort of domain is likely to really reap benefits in the longer term. And continuing that kind of trend over a number of years is really where you'll see the benefits, rather than a short-term super fix that's not sustainable.
Great, thanks, John. Steve, your top tips before we go on to the Q&A? Oh, Nicky first.
Yeah, the big thing for me is, we're just saying then, it's to break things up into the manageable chunks. It's like if I was going down the shop now, I take one of the kids or two of the kids with me. So it sounds awful, I'll get to spend some quality time with the kids, but also getting the exercise in, because so many people, with me as well, it's like I've got to go on the gym, I had to go on the bike. Whereas now I've started looking at my energy levels are drastically smaller. That how many, birds can you kill with one stone, as they say, so can you go out there, spend great time with the kids, also getting out there doing, walking briskly if you need to, let the kids go on their bikes, try and do more, all in manageable chunks, so you can sort of go out there and get a more of a balance to life. Another thing as well, if you're having problems, there's bound to be other people as well. So for me, just talking about it, at times you'll get the negative ones that turn around and go, oh, here we go, here it again. Or you'll actually strike the chord with one or two people who might not say something straight away, but they'll come out, when they're by themselves, come over, and all it takes is just to help one person. And if we all can try and help one person, that just builds massively. And that's what I've found's happened to me over the last 2 years. But yeah, thanks very much for today.
Fantastic, thanks, Steve. And then Nicky, if you can quickly give us your top tips.
I will. Yeah,
and then
mindfulness, or otherwise known as me time. Even men need a little bit of that. So you could use some of the mindful techniques, and I guess it's about how you sell mindfulness. We did introduce that into construction. Amazingly, I thought we'd be left out of the room, but actually we introduced it and it worked really well. But it can be as much as when you put in a bit of cream on your face at night before you go to bed, just giving yourself that few minutes of time out. Again, as employers, bringing that message to men that it's okay to show any vulnerabilities or challenges, engage them in that, and that will encourage the openness that we've been trying to kind of bring home. And finally, support and education of your managers to make sure they've got all those right skills to be able to deliver and have those difficult conversations or open, transparent conversations.
Fab. Thank you so much, panel. I'm really conscious of time, so what I'm going to do, we've had quite a lot of questions, so we will be doing a Q&A sheet, but I will just fire one out to each of you. Okay, so we'll stick to the tried and tested order, so it'll be one for you first, Dr. John, and thank you everyone as well for your questions and some lovely thought. Just people have shared some lovely bits as well, which is really good. So you mentioned, John, about the NHS screenings for men. Do you have to ask for these, or do you get invited? A gentleman here said that he's 50, he's never had one, he's never been asked for one. So is that something that he can approach his GP about?
Yes, so 100%. So he can phone up for his GP, ask for a sort of similar idea, sort of well-managed check or a physical health check, especially now that he's in that age bracket, and his GP will we'll do a sort of risk assessment. It'll be a blood pressure check, a quick physical examination, a check of anything else, and any other investigations that his GP might want. So yes, 100%.
Okay, fantastic. Somebody else has mentioned here about getting in touch with a GP is quite tricky at the minute, so I guess that's probably one of the challenges. But that's good to know. Thank you, John. So Nicky, with some Doug McLeod, McLeod, sorry if I pronounced that wrong, Doug. With the increase of working from home and hybrid working, are you seeing a change in men's health as a result? And what suggestions do you have for employers to encourage good health outcomes when staff are not necessarily gathering together face to face?
Yeah, I think we've all noticed that people are much more isolated. So it's about looking at how they can break down those barriers and prevent that isolation. So some of the kind of points are to have kind of more team meetings, but also actively to encourage get-togethers so that they can have that kind of free forum and help. I think, you know, the kind of break of the screen, for some, they find that okay, others really struggle with it. So I think it's around looking at some sort of hybrid point going forward. But I think, you know, it's still important to continue those one-to-ones, to continue that relationship with your individuals. But also one of the things that we kind of do at Medigold and we do in our clinical setting, which seems to work really well, is we'll have what we call supervision sessions, but actually sometimes it's a group that get together to share common themes, things that are kind of challenging us at the moment, but it's in a safe, constructive environment. So I think that's a really good way of kind of bringing that engagement together through the screen. But I still believe that getting together is really useful too, and often much more kind of people will probably be more open in that perspective because you can speak in smaller groups rather than just take it in turns like you do on the screen.
Yeah, okay, thank you, Nicky. Speaking of turns, it's now Steve's turn. I've had a couple of questions along the same theme, Steve, and some lovely comments as well. People really appreciating your honest share. But from a woman's perspective, how can we help men? And, you know, and somebody's put here, I don't want to come across as the nagging partner, you know, so from your sort of experience with Steph as your wife, who you said is really supportive, any sort of tips on how we can help the men in our lives, whether that's at work, at home, wherever, with sorting their health out or getting help with their health? Yeah,
the big one for me is one, it's, you know, it was for me to actually stand up and say, you know, I'm in trouble here. And you know, Steph's been absolutely brilliant because she's not, as you say, like pecking my head. She helps me organise my life. You know, she helps me do those things, but she's stern with me as well. But she understands when I'm in the highs and lows and understands the time of doing that. You know, before I used to say we were going out to a restaurant and suddenly I started getting anxious about going out. I used to kick off an argument on purpose, I think, just so I could turn around and say, oh, you're being out of order, I'm not going anymore. Whereas now she doesn't even come into that argument. She just walks away, and then 10, 15 minutes later, you know, I've obviously sorted myself out a bit and I'm apologizing and we're going out. So it's all about that, just understanding that, you know, we do go through that period of going up and down. And, you know, it's hard. But, you know, I must admit, I'm very lucky. Our relationship's probably the strongest now than it has been in 10 years of us being together, because we're understanding what, you know, I'm going through, but then also I understand what she's going through. So I know she needs time out as well.
Great advice. Okay, thank you. So that's it. So as I say, we have had a lot of questions, so I will collate those. I'll speak to the panelists and we will get a Q&A document sent over in the next week. You will receive a link to the recording in the next day or so. But it just then leads me to say thank you so much to our panelists. Really informative session, and thank you so much to our audience for joining us.